Well, absolutely. It's a busy time in most optometry practices where we're encouraging parents to bring the kiddos in, have that eye exam before school starts. I think that's probably typical in all eye practices across the U.S., that the month of July and into August, depending on what part of the country you live in, when school's starting. Here in Louisiana, they're starting at the beginning to middle of August. So getting the kids back in right now is super important. Getting those prescriptions updated, a second pair of glasses, the sports pair, having those conversations about what are we going to do when we're playing football, basketball, softball, gymnastics. And a lot of times we're even getting kids into their first pair of contact lenses as well.
So with the just digital device prevalence in classrooms, and the students and pediatric patients are on their devices more and more frequently, how are you combating dry eye or visual fatigue with a pediatric patient?
Right. So I have a handout that I give parents, and it starts off by setting the kiddo up for success. So we want to look at how close are their screens. And maybe that's not something that we can control while they're at school. We can tell the students to, keep the monitor at arm's distance, so that, maybe they touch it with their fingertips, but not the palm of their hand. We can encourage them by setting things up at home in the proper manner. Having the monitor in a downward gaze is another key, so that we're looking 20 degrees down, and then inciting that 20-20-20 rule. So we're encouraging students to take a 20-second break every 20 minutes, and typically, we've told patients to look 20 feet away during that break time. That little break in the up-close focus was thought to help control myopia. Now, it turns out there's not a whole lot of research around that, that 20 seconds is going to do a lot to help myopia. But I do think taking that break and having a couple of really significant blinks at the same time can help to re-stimulate the meibomian glands, get them working again while they're sitting in their chairs. They're not having to get up and move around the room to do this exercise of their eyelids, and get the meibum to start flowing again. Above and beyond that, we actually provide parents with a dry eye kit that's specifically designed for that pediatric population. So we're not asking kiddos to put drops in their eyes, especially while they're at school. These are things that they can do before and after school to really take care of their eyes, ensure that the ocular surface is staying clear and the meibomian glands are working. So I've got 3 little products that we put in these kits, and then we can encourage parents to purchase a kit to take home. There's a hydration, and instead of, like I said, I don't want kids putting eye drops in their eyes, we're using a hydration drink. So a stick of solution that they put into their water bottle, shake it up, and that just increases the absorption of the water in their bodies so that they have the building blocks for those healthy tears. The second one is an eyelid and lash wipe. So cleansing off dirt, dust, debris, pollen, because those kiddos are, having after school sports, making sure the lids and lashes remain clean can help reduce the inflammation that's around their eyes before they sleep at night. And then the final one is a warm compress. I really like the air-activated warm compresses because we know it's not going to be too hot. It's not going to come out of the microwave and burn the eyelids, but doing that air-activated warm compress is something that kiddos can put on their eyes, leave on for 10, 15 minutes, take off, throw away. So the hygiene is still there as well. They're putting something clean on their eyes. And just doing these 3 things throughout the day is really giving their eyes the building blocks of healthy tears, keeping them lubricated on the front surface of our eyes, because our kids are now spending 8 hours at school on the computers, and then they're coming home and reaching for a device as well.
Absolutely. So those 3 products, are those products that you are giving all patients, or are there particular patients especially that are presenting with dry eye symptoms that you're leaning them towards these products?
Right. So I think either way, definitely if parents are asking about what can we do, what can we talk about, I notice they're rubbing their eyes at the end of the day or complaining that vision is fluctuating. Those are patients that definitely you want to step in and make that recommendation that the eyes are getting dry. There's things that we can do to support your body so that it can make healthy tears and we don't do damage to the meibomian glands at this young age that's going to, inhibit development of healthy eyes going forward. But it's such a simple 3 products that we put in a little to-go bag. We can give them out to every parent with a handout about why it's useful, and then they can stock up on those products as needed.
Absolutely. So, are there any symptoms or maybe explanations of symptoms from these pediatric patients or from parents that differentiate dry eye from those pediatric patients from adults? Is there anything that is unique to how a child experiences dry eye?
I think they might not have the words to tell us what's going on with their eyes. So they may say that their vision is blurred, and we're not getting that vision is fluctuating. They're just saying that their vision is blurred. And they might not even realize that the tiredness that they feel or the grittiness is something that they should talk about, because maybe they think it's normal, they've been experiencing it for a while and they don't bring it up. So I think parents who notice that kids are, rubbing their eyes a lot, it's not just allergy. That might be the first thing that a parent would think if they catch their kiddo rubbing their eyes. It's not allergies, it's not because they're itching, it's because they feel gritty or tired, and then they're rubbing their eyes. So I do think it's worth digging into if your patient comes in and says something about blurred vision or itchy eyes. It might not just be the things that we're thinking of, that it's myopia or allergy, might be digital eye strain instead.
Absolutely. So on non-compliance with pediatric patients, say you have a patient who is struggling with, taking breaks from devices, or, is experiencing dry eye symptoms, but maybe not going through, all the steps, or the parent is finding it difficult to keep up with those steps. What are some ways that either you combat non-compliance with education, or are there any other tips that you provide?
Well, it's a difficult problem, right? Because our kiddos have their own digital devices, so it's hard to implement these boundaries. But I think as parents, we can put boundaries into place and just suggest these boundaries to a parent in front of the child, that this is going to have an effect on their visual system going forward if we allow them to stare at near devices for as many hours as they are doing. We can actually make myopia worse or start to see signs of myopia. So I think putting those boundaries into place and just reiterating that this is a problem that could get worse as the kid ages, and making those recommendations of being outdoors for 2 hours a day. There's a lot of studies about how beneficial 2 hours of outdoor time is to kids, and getting them into a sport or an activity that gets them outdoors is another suggestion that I use often. And then finally, I would say reiterating that screen distance, because kiddos, they do have that accommodative system where they can bring screens right up to them, and they're constantly having the phone in their faces, having them push it away. Maybe having a stand that, you can watch your device, but you have to leave it in the stand and sit back from it is something else that we can reiterate to parents.
Absolutely. Anything else that you wanted to touch on that we haven't touched on yet?
I just think that back to school time is such a great time in all of our eye doctor practices because we have that enthusiasm of maybe a first eye exam and telling parents when is it appropriate to have an eye exam as they bring their kid in for their first time before back to school. We need to see you every year. An eye exam is something that is an annual event, and really putting that into the minds of not only the kids, but also the parents, that they need to bring their other loved ones and family members into the offices so that we see every single member of the family every single year, and reiterating that an eye exam is not optional. If older sister, younger brother sees better than the kid that's sitting in the chair, that doesn't mean that the other child shouldn't get an eye exam as well. So I think that's a falsity that lots of parents fall under, is that, well, the other child doesn't wear glasses, so I don't need to bring them. But really encouraging that it's an annual exam. We need to check the overall health of the eyes. Getting them in every year is just a good habit to instill this time of year.